A breast cancer diagnosis comes as a shock for many, and often the scarring from surgery isn't something many patients think about.
As Tess Hedrick explains in tonight's Avera Medical Minute, a new breast surgery technique is giving patients a better cosmetic outcome, all while being just as safe and effective.
My mom was diagnosed with breast cancer in April of 2015.
As Patty Rabine's mom started her breast cancer journey, Patty wondered if it was genetic.
I just happened to be on campus one day with one of my friends, and we were talking, and Dr. Merrigan overheard that my mom had breast cancer, and she asked me what kind it was, and I told her triple negative, and she recommended that my mom be tested for the BRCA mutation.
Patty's mom then met with Kayla York, a genetic counselor at the Avera Cancer Institute. Her results came back positive for BRCA2. That's when Patty decided to get tested as well.
I knew there was a 50% chance, but I guess I just wasn't really prepared. I just really thought that that wasn't the news I was going to get that day. Once I got the news that I was BRCA2 positive and I visited with the doctors, I knew I was going to ultimately have the prophylactic surgery.
Dr. Tricia Merrigan with Comprehensive Breast Care told Patty what options she had.
It is nice to know that, they have the opportunity to have a good cosmetic outcome with everything that they've gone through.
My biggest concern actually was probably like, well, gosh, do I really want to look at scars like that? I know what my mom went through, and I've seen my mom, and she did not have reconstruction. Dr. Merrigan actually said, hey, Dr. Shashikant, he's doing some newer stuff. Do you want to visit with him about it? And I was like, yes.
We're trying to make sure patients have every option available to them to get the best result that meets their expectations. And for some patients, they would really prefer the scars to be in places that are not as obvious to the naked eye as other scars can be. The idea of the hidden scar is in what way can we leverage the technology that's available right now to provide that for patients.
A typical scar for breast reconstruction or mastectomy would be across the front of the breast. With the hidden scar technique, the surgeon puts the scar underneath the breast or camouflages them in different folds so they look more natural.
So Patty, how long has it been since your surgery, since your last procedure?
After discussing the hidden scar technique with plastic surgeon Dr. Mark Shashikant,
Definitely.
Patty felt this was the right choice for her.
When I look in the mirror, I really don't see any reminder of what I went through, and I feel like that really just helps. That helps with the moving on process.
In some ways, we've always had to compromise between what's going to look best on the patient and what's best for the patient's cancer surgery. And technologies like these are finally allowing us to do both at the same time.
With your Avera Medical Minute.
Was it a pretty smooth process?
I'm Tess Hedrick, KSFY News.
Using the hidden scar technique does not increase the patient's risk of recurrence.